Krill oil. Other names: Acidite de krill, Acidocus hexaenoic, Acides gras omega-3, Acides gras N3, Acides gras polyunsaturated, Acides gras W3, Antarctic krill oil, concentrated proteins marines, DHA, docosahexaenoic acid, EPA, Euphorsia superba oil, euphorsiase. Uses: high cholesterol. Developing research shows that taking 1.5 grams of a specific krill oil product, Neptune Krill Oil, Neptune Technologies and BioAir Sources Incorporated, daily reduces total cholesterol and bad low-density lipoprotein, LDL, cholesterol, and increases good high-density lipoprotein, HDL, cholesterol in patients with high cholesterol. Higher doses of 2-3 grams daily also appear to significantly reduce levels of triglyceride, another type of blood fat. Osteoarthritis. Early research shows that taking 300 mg of a specific krill oil product daily reduces pain and stiffness in people with osteoarthritis. Premenstrual syndrome, PMS. Early research shows that taking a specific krill oil product might reduce PMS symptoms. Rheumatoid arthritis. Early research shows that taking 300 mg of a specific krill oil product daily reduces pain and stiffness in people with rheumatoid arthritis. High blood pressure, stroke, cancer, depression, other conditions. Side effects: moderate interaction. Be cautious with this combination. Medications that slow blood clotting, anticoagulant, antiplatelet drugs interacts with krill oil. Krill oil might slow blood clotting. Taking krill oil along with medications that also slow clotting might increase the chances of bruising and bleeding. Some medications that slow blood clotting include aspirin, clopidogrel, Plavix, diclofenac, Voltaren, Cataflam. Others: ibuprofen, Advil, Mortrin. Others: naproxen, Anaprox, naproxen. Others: dalteparin, Fragmin, enoxaparin, Lovenox, heparin, warfarin, Coumadin, and others. Minor interaction. Be watchful with this combination. Orlistat, xenical, Ali, interacts with krill oil. Orlistat, xenical, Ali, is used for weight loss. It prevents dietary fats from being absorbed from the gut. There is some concern that orlistat, xenical, Ali, might also decrease absorption of krill oil when they are taken together. To avoid this potential interaction, take orlistat, xenical, Ali, and krill oil at least 2 hours apart. Krill oil is possibly safe for most adults when used appropriately for a short amount of time, up to 3 months. Research on krill oil has not adequately evaluated its safety or possible side effects. However, it is likely that krill oil can cause some side effects similar to fish oil, such as bad breath, heartburn, fishy taste, upset stomach, nausea, and loose stools. Special precautions and warnings. Pregnancy and breastfeeding. Not enough is known about the use of krill oil during pregnancy and breastfeeding. Stay on the safe side and avoid use. Seafood allergy. Some people who are allergic to seafood might also be allergic to krill oil supplements. There is no reliable information showing how likely people with seafood allergy are to have an allergic reaction to krill oil. However, until more is known, avoid using krill oil or use it cautiously if you have a seafood allergy. Surgery. Because krill oil can slow blood clotting, there is concern that it might increase the risk of bleeding during and after surgery. Stop using krill oil at least 2 weeks before a scheduled surgery. Overview. Krill oil is oil from a tiny, shrimp-like animal. Baleen whales, mantas, and whale sharks eat primarily krill. In Norwegian, the word krill means whale food. People extract the oil from krill, place it in capsules, and use it for medicine. Some brand name krill oil products indicate that they use Antarctic krill. This usually refers to the species of krill called Euphorsia superba. Krill oil is used for heart disease, high levels of certain blood fats, triglycerides, high cholesterol, high blood pressure, stroke, cancer, osteoarthritis, depression, premenstrual syndrome, PMS, and painful menstrual periods. How does it work? Krill oil contains fatty acids similar to fish oil. These fats are thought to be beneficial fats that decrease swelling, lower cholesterol, and make blood platelets less sticky. When blood platelets are less sticky, they are less likely to form clots. Krill, Euphorsia superba, is a small crustacean with an appearance similar to shrimp. They are found in the colder waters of the ocean. Krill primarily serve as a food source for other animals in the ocean, for example, whales, seals, penguins, squid and fish. Krill is found in the oceans off of Antarctica, Canada, and Japan. Harvesting of krill is controversial. There is concern that commercial harvesting of krill for use in krill oil supplements could threaten the species that consume it for food, including whales. All krill oil sold in nutritional supplements is harvested out of the open ocean, upsetting the natural balance of food supplies for larger marine animals. Commercial uses of krill include salmon, aquaculture farming, harvesting for use in krill oil capsules, as food for home aquariums, and as a human food source. Krill, known as okiami, has been harvested by the Japanese as a human food source since the 19th century, and is also consumed in South Korea and Taiwan. Krill has a pink or red appearance due to the plankton that they consume as a food source in the ocean. 1. What is in krill oil? Krill contains an oil that is similar to the oils found in fish oils, the omega-3 fatty acids. Omega-3 fatty acids are recommended for use in lowering triglyceride levels. Krill oil used as a supplement to lower blood lipids is increasing in popularity. 1. Krill oil contains the omega-3 polyunsaturated fatty acids EPA, iosapentanoic acid, and DHA, docosahexaenoic. Omega-3 polyunsaturated fatty acids are also found in oils from certain types of fish, vegetables, and other plant sources. Unlike fish oil, the omega-3 fatty acids in krill oil are absorbed and carried to the body's cells in phospholipid form. Omega-3 fatty acids, in combination with diet and exercise, work by lowering the body's production of bad, low-density lipoprotein, LDL, and triglycerides, and may raise high-density lipoprotein, HDL, good cholesterol. High levels of cholesterol and triglycerides can lead to coronary artery disease, heart disease, and stroke. Krill oil also contains phospholipid-derived fatty acids, PLFA, which may result in better absorption, and marine lecithin 2. A carotenoid antioxidant called astaxanthin. Antioxidants inhibit oxidation and may neutralize the oxidant effect of free radicals and other substances in body tissues that may lead to disease. Krill oil has also been used to treat high blood pressure, stroke, cancer, osteoarthritis, depression and premenstrual syndrome, PMS, although high-quality studies with adequately sized populations validating these uses are lacking. Patients should speak with their physician prior to using krill oil for any condition. Warnings issued by the FDA note that certain fish, marlin, tuna, swordfish, may contain toxins such as methmercury, leading some consumers to be wary of eating fish to obtain omega-3 fatty acids. Manufacturers of krill oil suggest it may be safer due to lower levels of contaminants such as mercury. The FDA has issued recommendations that women who are pregnant or planning to become pregnant, and young children avoid eating more than 6 ounces of fish per week. However, krill may also contain methmercury and other pollutants from seawater, although they are lower on the food chain and they may contain lower values of such pollutants. One study noted that krill harvested from Antarctica contains high levels of organic pesticides. 3. Manufacturers of krill oil claim one of the advantages of krill oil over fish oil is that it does not lead to the fishy aftertaste, reflux or belching of fish flavors, a common side effect with fish oil supplements. However, krill oil may still lead to these side effects in some patients. The U.S. Food and Drug Administration, FDA, has not specifically made recommendations on krill oil safety or effectiveness. Krill oil is considered a dietary supplement and does not require a prescription. Krill oil may also be used for purposes not listed in this medication guide. Important information. Take krill oil exactly as directed on the label, or as prescribed by your doctor. Do not take it in larger amounts or for longer than recommended. Krill oil should not be used in patients with a fish or shrimp allergy, or probably any other type of seafood. Tests for susceptibility to allergic reactions to krill oil have not been completed. People with coagulopathy or taking anticoagulants or other medications should notify their physician prior to taking dietary supplements. Stop taking krill oil at least 2 weeks prior to any scheduled surgery or procedure. Swallow the krill oil capsule whole. Do not puncture or open the capsule. Marine oils, such as krill oil, is only part of a complete program of treatment that also includes diet, exercise, and weight control. Follow your diet, medication, and exercise routines very closely. There may be other drugs that can interact with krill oil. Tell your doctor about all medications you use. This includes prescription, over-the-counter, vitamin, and herbal products. Do not start a new medication without telling your doctor. Stop using krill oil and get emergency medical help if you think you have used too much medicine, or if you have any of these signs of an allergic reaction: hives, difficulty breathing, swelling of your face, lips, tongue, or throat. Do not use marine oils like krill oil if you are allergic to fish, shrimp, or any other type of seafood. Be sure to check the label on the krill oil package to look for other active or inactive ingredients that may cause an allergy. If you are not sure, ask your pharmacist. Ask a doctor or pharmacist about using this medicine if you have diabetes, liver disease, a pancreas disorder, blood clotting disorder or risk of stroke, upcoming surgery or procedure that might increase your risk for bleeding, underactive thyroid. If you drink more than 2 alcoholic beverages per day. It is not known whether krill oil will harm an unborn baby, although certain prescription omega-3 fatty acids, low VASA, have a pregnancy rating C. Tell your doctor if you are pregnant or plan to become pregnant while using krill oil. It is not known whether omega-3 polyunsaturated fatty acids pass into breast milk or if this could harm a nursing baby. Do not use krill oil without telling your doctor if you are breastfeeding a baby. Do not give this medication to anyone under 18 years old. 1. See also, fish oil and pregnancy and breastfeeding warnings, in more detail. How should I take krill oil? Use krill oil exactly as directed on the label, or as prescribed by your doctor. Do not use in larger or smaller amounts or for longer than recommended. Swallow the krill oil capsule whole. Do not puncture or open the capsule. Krill oils may work best if taken with food, although marine oils like krill oil are only part of a complete program of treatment that also includes diet, exercise, and weight control. Follow your diet, medication, and exercise routines very closely. Store krill oil at room temperature away from moisture and heat. Do not freeze. What happens if I miss a dose? Take the missed dose as soon as you remember. Skip the missed dose if it is almost time for your next scheduled dose. Do not take extra medicine to make up the missed dose. What happens if I overdose? Seek emergency medical attention or call the poison helpline at 1-800-222-1222. What should I avoid while taking krill oil? Avoid eating foods that are high in fat or cholesterol. Krill oil will not be as effective in lowering your triglycerides if you do not follow the diet plan recommended by your doctor. Avoid drinking alcohol. It can increase triglycerides and may make your condition worse. Krill oil side effects. Get emergency medical help if you have any of these signs of an allergic reaction to krill oil: hives, difficulty breathing, swelling of your face, lips, tongue, or throat. stop using fish oil and call your doctor at once if you have any of these serious side effects. Fever, chills, body aches, flu symptoms, chest pain, uneven heartbeats. Less serious krill oil side effects may include back pain, mild skin rash, fishy aftertaste or belching in some patients. This is not a complete list of side effects and others may occur. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA 1088.1. See also, side effects, in more detail. What other drugs will affect fish oil? Tell your doctor about all other medicines you use, especially estrogens, birth control pills or hormone replacement. A blood thinner such as warfarin, Coumadin, Jantoven. Aspirin or NSAIDs, naproxen, ibuprofen, Aleve, Mortrinib, Advil. A beta blocker such as atenolol, tenormin, Tenoritic, Carvedilol, Coreg, Labetalol, Normadine, Trandate, Metoprolol, Dutoprol, Lorpressor, Toprol, Nadolol, Corgid, Propranolol, Inderal, Inopran, Sotalol, Betapis, and others, or a diuretic, water pill, such as chlorothiazide, Durol, hydrochlorothiazide, hydrodural, microzide, clethaladone, hygroton, thalatone, indapamide, lozol, metolazone, microx, Xeroxolin, and others. Orlistat, Xenical, Ali, for weight loss.